everybody. My name is LisaMann. I'm a physician assistant with H&I Healthcare. I also work at Park Royal Hospital with Acadia. So I'm really excited to be here with all of you guys. I recognize a lot of organizations from our discharge data sheets. We've worked with you guys a lot. It's good to see some faces attached to those organizations. So Park Royal Hospital has a lot of services we offer. We treat a lot of different illnesses. With our inpatient care, we have our dual diagnosis. So we work with patients who have a psychiatric diagnosis as well as addiction issues. So we have a 28-day program. If they choose to complete that, they get a certificate at the end, and we work with them throughout the course to make sure we optimize their chance of success. We do medication-assisted therapy if deemed appropriate. Obviously, that's something you want to be very selective with. So we do work with Subutex and Suboxone maintenance therapy. We have our geriatric unit, which there is absolutely no shortage of here in Florida. We have a lot of resources for them. We work very closely with skilled nursing, with ALF, different community resources we refer them to. We have our general inpatient adult psychiatry, so that's our anxiety and depression. We work with those patients. It's issues that a lot of us face, especially now with COVID-19. So we're seeing an influx in that population. We have a women's unit, which is really great because for women who've been through trauma and just feel more comfortable recovering around other women, that's an option for them. We also have our acute psychiatry unit, which is my personal passion. That's our patients who are having hallucinations, our patients who are feeling paranoid or just disoriented. You would not believe how many people who are high functioning, go about their everyday life, have psychotic symptoms like this and are so afraid to talk about it because they think they're going to get a label or it's going to ruin their career. And we work with those patients to help them understand those symptoms. We have our ECT program, which I'm really excited about. ECT is a good option for treatment-resistant depression, but it can actually be used at any stage of depression. I see a lot of patients who have tried a ton of medications and they're just like about to give up, and ECT really turns things around for them. It's a bit scary. I think it's a bit intimidating for people, but we're seeing a lot of good results. So we have information about that on our website if anybody's interested. Let's see, we have our step down to PHPIOP. So that's where you get a little bit more support, more than you would if you were just seeing an outpatient psychiatrist. You would see our therapists and our psychiatrists more often. You would work with groups on coping skills and just kind of have that additional support if you're going through a rough time in your life. One really cool thing, probably one of the few cool things with COVID, is we were able to establish telemedicine to keep people safer at home. So we can do virtual with a tablet, even a phone. We can do our assessments, our groups, everything that way. So it gives people also the option to be more discreet or private if that is their personal choice. Lastly, the one thing I wanted to talk about with our team, we really like to keep up to date on stuff. So we talk a lot about like, hey, did you see that new article? Have you seen this new research? One of the things we were talking about this week is, I don't know if you guys have heard of fecal transplants, because they're finding that gut bacteria is related to anxiety and depression. I think that's going to be a hard sell. We don't do that yet. I think it's going to go harder than ECT to sell that to Park Royal, but it's really neat. You guys should look into that because we thought that was cool. But yeah, we try and provide the most up-to-date care for our patients. So thank you for having me here.